Good morning, all. Am I audible? Great. Okay. So we are starting our reading club with the prayer.
हमको मन की शक्ति देना, मन विजय करे, दूसरों की जैसे पहले खुद को जय करे। हमको मन की शक्ति देना, मन विजय करे, दूसरों की जैसे पहले खुद को जय करे। हमको मन की शक्ति देना, भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, दूसरों के जैसे पहले खुद को जय करे। हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जैसे पहले खुद को जय करे। हमको मन की शक्ति देना।
Good morning, all. Giving tribute to our great master, Dr. Samuel Hahnemann, for this wonderful divine science and taught us that to be wise. We all seeking blessings from our Guru, Dr. Prafull Vijayakar, sirs, who have breached this divine science with the modern science and made homeopathy easy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijayakarai. Friends, we are in the journey of understanding the wisdom of Dr. Samuel Hahnemann from the Origin of Medicine, Six Medicines, as well as reading the book of Dr. Prafull Vijayakar, sir, Genetic Materia Medica. In order to understand and Hahnemann, we need to understand the language of organon. And up till now, in organon, we have completed the theoretical part from 1 to 70 aphorism, followed by we have understood the disease part, then we have understood the case taking, and also we have understood the pathogenetic power of the medicines, how it is pure by drug proving. And the third point of the business of the homeopath is to apply the knowledge of materia medica or knowledge of medicines or the knowledge of the pathogenic power of drug to the knowledge of the disease. And that is what the approach is. So up till now, Master Hahnemann has advised us that when you have a definite character of the symptoms and when you have the symptoms you match with the similar symptoms of the disease, then cure must ensue. This is the sure and short. Because of law of nature is eternal. And the second point that what Master Hahnemann telling us in aphorism number 149, that when you find trivial symptoms of disease and it is one or two, and in that case, if you find that it is the symptoms which is by helping by changing in the diet and regimen, it will be nullified, then no need to prescribe a homeopathic remedy. So, going further in this process, we have aphorism number 153. It is the most important aphorism in the field of homeopathy, and all homeopaths must agree with this that to find out the homeopathic remedy of a specific case, that is, the remedy should be prescribed on the basis of the symptoms which is most important, which is most characteristic, which is most striking, which is uncommon and peculiar, and then you will get the result and got the cure. So reading in this aphorism number 153, in this search of homeopathic specific remedy, that is to say, in this comparisons of collective symptoms of the natural disease with the list of the symptoms of known medicines, in order to find amongst these an artificial morbific agent, that is a remedy corresponding by the similarity of the disease, that is the law of similia, to be cured, the more striking, singular, uncommon, peculiar, characteristic sign and symptoms of the case of the disease are chiefly and most solely to be kept in a view. For it is more particularly this that very similar one in the list of symptoms of the selected medicine must correspond to in order to constitute it most suitable for effecting the cure. The more general and undefined symptoms like loss of appetite, headache, debility, restless sleep, discomfort, and so forth demand but little attention when of that vague and indefinite character, if they cannot be more accurately described, as symptoms of such a general nature are observed in almost every disease and from almost every drug. So he has given a wisdom that when you find SSUPS, that is the striking singular uncommon peculiar symptoms and sign of the patient, then cure must be effective. So this is what you have to find out SSUPS from the patient. So up till now we have understood the genetic makeup of the medicines from the patients. Dr. Vijayakar sir has taught us that how to understand the genes. So from the genetic makeup, we have to find out something which is more striking, more singular, more uncommon, and more peculiar, and that individualize the character, that individualize the persons, and that is what the characteristic symptoms of the remedy we have to find out in Materia Medica and match with the law of similia so that you will get the result. And also he has warned us that the general symptoms like a loss of appetite, headache, debility, restless sleep, and discomfort, which is most commonly found in all the diseases. But if this is having some PQRS or this is having some SSUPS, then you have to keep in view. But if it is a general vague symptoms, then you cannot take into consideration. This is what Master Hahnemann advised us. So this is the wisdom of Master Hahnemann, and to make this possible, what Bonnie-Hussen has made, that Bonnie-Hussen was the first to publish the characteristic symptoms of homeopathic medicines and his repertory. and which gives a great service to homeopathy, as well as J.H.G. Jha in his Handbook of Principle of Symptoms. He has also written the PQRS. See, so for us, the PQRS or SSUPS of the case is most important. So in order to get the result, in order to cure the patients, we need to find out SSUPS from the patients. So we will continue the further reading of our genetic materia medica. So we all know that in genetic materia medica, we have understood the cellular mechanisms of the genes, and the gene gives us a particular point that we have to understood the mental makeup, the physical makeup, and his voice is clear. From my side, everything is clear. Good morning. Okay. So, in genetic materia medica, we have understood that our body is made up of the genes, and the genes reflect in the mental makeup, genes reflect in the physical makeup, and the gene is reflecting in the general and the particular makeup, so that our gene can express in everything. So, we need to find out everything from the individual perspective so that we have to treat the man genetically, and what Dr. Vijayakar sir told about that genetic constitutional similar, so that we can find out the genetic constitutional similar. So in further reading of these books, we will continue with understanding of our materia medica part, and that is what Baryta. So Baryta group, sir has given a generalizations, and from the generalizations, sir has put the one remedy as a keynote remedy in a particular group, and on the basis of that, you can identify the individual characteristics, and on the basis of that, you can apply this knowledge to into practice. So in Barytas, the Baryta carb is one of the leading remedy. So to understand Baryta carb at the genetic level, and to understand Baryta carb physical makeup, the mental makeup, but general makeup, and the disease makeup. So Baryta carb, will continue reading this. So Baryta carb is a remedy minimally understood. Now slide is visible to all. Slide is visible to all. Please reply. Now audible, clear?
Dr.
Okay.
Amit, you are seen and clear, but the slides or the screen sharing is not there at all.
We'll share a slide. Something went
Yeah,
wrong with the Zoom workplace. I
that's
don't
okay.
know
Yeah,
how it is happening.
all right.
Okay, fine. Now I'm sharing the slide. Okay, now it is visible to all.
Yes, it's visible. Thank you.
Okay, fine, great. Okay, fine. So we will continue the Barytas. So Baryta is one of the keynote remedy from the Baryta group. To understand the group as a genetically so that we can apply this knowledge into our practice. So we all know that Baryta Kav is the remedy minimally understood by the homeopaths. The whole Materia Medica book explain and present this remedy and its symptoms in such a manner that the knowledge gained about this remedy excludes this remedy from being used. This remedy has always been projected at one mean for mentally retarded, physically dwarf, foolish, shy, timid, and idiotic personality. The book tells us that there is a defective development of the brain and the intelligence is not properly developed, and there is a confusion all over. So, on the basis of that, this remedy has been used in our Materia Medica in olden days. So homeopath, especially the constitutional prescribing homeopath, wait for a patient with such a description to come to their clinic all their lives. At the end of 20 years of the practice, at the end of 20 years of the practice, some homeopaths may have prescribed this remedy in two or maybe three cases, and that too with a varied result. If one understands this remedy properly, one will see that there are many more Baryta constitutions around than the world can ever dream of. Baryta carb could even complete with like the Calcarea carb and Naxomica in terms of frequent encounter. So timidity, bashful, late milestone, poor memory, and less intelligence, dwarf, unable to take up the responsibility. It is etc. is the Materia Medica book picture. Should we wait to prescribe Baryta till we get the patient with the delayed milestone, foolish or idiotic behavior? Should we learn to see the Baryta element in the normally intelligent people also? So these are the questions that have to come into your mind. So let us see what is the quality and the trait in normal people that may lead us to prescribe the Baryta as a remedy. This is what a source clinical understanding and sir always find out how the person presented in the clinic and on the basis of observations and his behavior and attitude, sir prescribe a remedy. So let us see how we can understand Baryta from more practical point of view or how the Baryta presents itself into the clinic. So you have to take a note that when the person comes to you in your clinic, how they present to you. So in the clinic, when to think of Baryta, this is what you have to exercise your mind. Whenever any patient comes to you, you have to think about which personality he is. We have to search the individual, not the disease part or disease picture. So who is he? So Baryta carb can be taken as the chief representative of all Barytas. Other salts of Baryta will have a major trait of Baryta carb with the respective variations as will be discussed later. As we know, every individual is here on this earth to survive. Survival of the fittest is the rule of the world as per Darwin's theory. In order to survive, one has to make adaptations, and these adaptations are brought about to save the whole and are related to the inherited genetic trait. Thus, all the tendencies exhibited and the deficiencies seen and the modifications made by an individual throughout his or her life, whether in mental or the physical sphere, are the defense mechanism at work. So, this is what you have to keep in mind. Everyone has to have this phenomena. This mechanism is the things which gives us the tendencies, which gives us the deficiency and modification, and that is what we have to think of. So let us see the Baryta group. We need to know what is the things that Baryta sacrifice and how it is expressed and how it reacts to the deficiency. The first point, so Baryta sacrifice the growth, and it may only mental growth or both physical and mental growth. So this is what very important to understand, that for survival the growth is not needed and Baryta sacrifice that growth. So at physical point, that physical point may suggest Baryta, that suggest means that this constitution could be having a Baryta element. It does not mean that this has to be only Baryta. If all other symptoms like thermal, thirst, physical, etc. are matching, then this could be one of the Baryta salt. So physically following the observations that can suggest the Baryta ailment. So what could be the physical picture of the Baryta and what is the sacrifice? So short in stature. So we can think of the Baryta if man or woman is short in stature or what has not grown to his or her normal height. In this context, one need to take into consideration the genetic inheritance too. If the family members and all the families are the short-heighted, you cannot take it as that it is a short stature, provided all the symptoms has to make up the physical makeup, the mental makeup, and the general makeup has to match. If either of the parent or the whole family is short stature, then this shortness is not important and should not lead to one to infer that the whole family is Baryta. So you cannot think like that. Of course, if the intellect and the generals matches that Baryta, then Baryta can be ruled out. Undernourished people can also be short, thin, and emaciated constitution. They do not necessarily fall into category of the Baryta, as there is a reason for the same, and that is a lack of nutrition. So this is very important. The shortness of the Baryta, especially Baryta carp and the Baryta mure, needs to be differentiated. Here, the Baryta carp short and bulky with the rounded contour of the face. This is mostly more psychotic. They may have a thick and a short neck, the thick lip, often with the improper proportions of the parts of the body. So this is what you have to observe. The hand, feet, and the finger and toes may be thick and stub in the predominantly psychotic Baryta. So this is what Baryta carb is more psychotic. The keynotes is a dwarfishness. An overgrown, disproportionate individual can also be Baryta carb because of psychosis excess. So sometimes you find that calcarea and Baryta is very, very near. So Baryta mure is often thin with a thinner neck and the sharper features. The nose of the Baryta mure is thin and sharp, as again the thick, rounded, broad-based nose of the Baryta carp. So this is by observations you can think of the Baryta carp and Baryta mure. This is what a differentiating point of the same group remedy in this scenario. The second part, those who early bald. So that is what whenever the person comes to you in your clinic and at a young age there is a baldness, you can think of this he may be or she may be a Baryta carp. So the receding of the hairline from front at an early age, say by 25 to 30 years, can be present in the Baryta carp and Baryta mute. They especially Baryta mute shows a broad forehead. So on the basis of that, we can have the rubric, that is hair affections of general baldness and hair affections of general baldness in young people. So that is what you have observed. These are the physical points. The third point is the prominent bony structures of the jaw and the rounded face. The face of the Baryta has very prominent bone of the jaw, which gives it a squarish look, and the fat on the cheek that gives a roundish look. Generally, according to the science of physiognomy, squarish or the bony prominence on the face indicate the strong character with the positive courageous achiever. But here the character is completely misplaced. So whenever you find a very timid kind of personality, a bashful kind of personality with a squarish face, then you can think of it is a Baryta, the remedy. All the squarish face shows a strong jawbone line, and that is what they shows a strong and positive character. But when you find the squarish face people with the timidity and the bashfulness and the weak-willed personality, you can think of the Baryta cow. The second point in this is the mental behavior or observation that may suggest the Baryta. So up till now we have understood the physical point. In the physical point we have seen that it is the first point is a short stature, the sparkishness. The second point is a too early bald, and the third point that is what the prominent bony structure, but that does not matches with the characteristic of the personality. The mental behavior or the observation that may suggest varietas while considering the patient, the mental entry point are also help to investigate in the direction to confirm the prescription of variety. One sporadic event should not influence the physician to conclude that it is Baryta mind. So very important aspect of understanding that you have to keep in mind in all the life incidents. You have to understand that one fine day the person who cannot take a decisions and goes into lack of circumspections. And on the basis of you cannot think it is a Baryta, but in whole aspect you can think. So later on we are understanding the misplaced aspect of Baryta, you can more understood about this line. The mental makeup of the Baryta, one may start thinking of Baryta when one notes the following things. So the people who look down bashfully and are timid is very, very important. So whenever the person comes to your clinic and looking down and very, very bashful and shy, this is the persons are the Baryta card. So timidity is much exaggerated in Baryta card that do not want to show their face. They look down or away bashfully like a small girl. A child may have the habit of hiding his face with both his hand as if in the shame. So that we have a rubric like that the timidity bashful, the stranger presence of aggravate children covering their face with their hands but look through their fingers, hide desire to children in stranger from hide desire to children, thinks all visitor laughed at it and hide behind. So these are the people. The people who do not have a confidence in themselves, a grown-up adult when he always preferred to be accompanied by his mother or a father. This is the childlike behavior. This patient has no confidence of expressing himself to the doctor and would like someone else to explain his problem. He is as if not grown to be independent. The accompanying persons could be a smoother mother, father, friend, and even a spouse. Very often we find that a couple comes to us for a treatment, but the husband keeps quiet and the wife does all the talking. All your queries are answered by her, while the patient himself just smiles and nods. This gentleman does not look idiotic or foolish and could be an officer at some high post in the firm or even a businessman, but does not have an ability to communicate. So this is also very important observations when the people come to your clinic and adult accompanied by with the parents or a fathers, and that is what you have to think. So the rubric we have is confidence, want of self, responsibility late in children's, the childish behavior, old people in weakness of the will, and will none of his own has. So this is what everything was controlled by someone else. So it's totally dependent on someone else. So this is what we can think that is the infant like the stage, totally dependent on others and does not communicate. A high post or a tall academic degree does not rule out Baryta. A very important aspect of that. We all know that Baryta is always mentally deficient, but sometimes you find that is a high post personality can be Baryta. So, sir, always write that high post or a tall academic degree does not rule out Baryta helmet. On the contrary, behavior that does not befit a high post or a high academic degree is all the more an indication toward the Baryta ailment. So the post of people is so high, but his behavior is not according to that. It is what Baryta, the personality. So people who have too much confidence in themselves amounting to the foolishness. So this is very important understanding that one point we have seen that there is no confidence and there is a bashfulness and timidity. But when we find there is too much confidence, but that is going toward the foolishness, then also you can think of Baraita Kaab. So the lack of ability to consider what is possible and what is not, and the lack of ability to foresee the consequence, like makes the Baraita Kaab foolish and foolish daredevil. The proverb says that devil dares where angels fear to tread can be changed to the Baraita dares where normal people fears to tread is apt for the Baraita. They do not fear death and destruction, especially when they are in the psychosyphilitic mode. When there is no fear, the persons appear courageous, but the real courageous person takes calculated risks, and here in Baraita, no thinking of consequences gives them the courage. So we see the stuntman doing some impossible stunt that defy death. Such a stunt can be performed only if one is trained for it. But an ordinary person will not take any undue risk, but Paraita will. So this is what you can think. Paraita is there in the rubric. Foolish behavior, defiant and heedless, careless person. So, give an example that a person is ready to jump from the second floor of the building without safety measure in place can either be an expert or a barita. There seems to be no inhibitions if a complicated or a high level work is to be accomplished, like say taking permissions from the highly placed executive. Many people have inhibitions and apprehensions. What if he does not entertain me? What if he says no to me, my request? What if I am not able to put forth a right argument, etc.? But Baraita has no inhibitions because there is no apprehension. He can just walk in and do the work matter of faculty. So this is what very important that in a high post also and goes into much confidence leading to foolishness. So this foolishness also find out in the disease also. Say for example, sir has given an example later in this book also that the person comes to you with the complaint of the cancers and he having courage that I do not mind cancer. If there is cancer, okay, but please give me a relief to this my itching. So this is what you can think that this is the foolish behavior he had. He goes into heedless, careless about the actual gravity of the disease, but he is not concerned about his what we called as the more concerned about the skin ailment rather than the cancer. So this is what the foolish behavior, this is the heedless, careless behavior, and that is what the Baraita personality is. The people who are unarguably and unreasonably obstinate. So this could be a very difficult to handle the Baraita people. So many a time the Baraita people comes to you and they are very arguably and unreasonably obstinate and they are right and we are wrong. So that is what the personality is. So whenever you think of this type of obstinate personality, they cannot understand what is the gravity of situations and everything. Then and then you can think of is Baraita. One of the most difficult things is to convince a Baraita. Once an idea get embossed in their mind, nothing can shake it. This is what we generally mention as fixed ideas. There is no scope for any reasoning in a Baraita because whether whatever he has in his head is the final. The most difficult thing is to make them follow and do's and don'ts of homeopathy. They will invariably apply an ointment on the rest that has been explained to them as the exteriorization. This can happen more than once despite prior warning. And they may argue, how can an external disease disappear with an internal medication? They may go into extent of calling you foolish. So this is what the Baraita people is. So people who are unarguably and unreasonably obstinate. So rubric is obstinate, headstrong. Now the intellect part, it is the intellect of Baraita that is sacrificed for the survival. It is the defective intellect that throws and shows throws a shadow over the will, intelligence, moral and attitude, reaction and sensitivity, etc. Thus, all this element of the mind shows the wholesome effect of the faulty intellect. Without this type of intellect, it is not right to prescribe any Baryta salt. So here, very important aspect of intellect of the Baryta is sacrifice for the survival. So for survival, Baryta says, I don't require the intelligence. This faulty intellect can be present itself in the following different manners. So when the intelligence is failed or faulty, their behavior also becomes faulty. So how they represent to us? The people who smile a lot, many a time unnecessary during the interview. So this is very important whenever you are taking an interview and you find a very timid personality looking down and smiling. Again, you are seeing them looking down and smiling. The people who are smiling a lot, this is because his intellect is not working and he is not understanding and reasoning where he is. So this is the things you can find out. They smile and laugh occasionally for the pretty things, and you start wondering what is that funny? What was the funny? And there are ladies who every and now then hide their face in their hands and look away smilingly and bashfully to show the embarrassment at the slightest cause. This could be the Baryta. So the rubric which matches with this that smiling alone when the laughing causeless, laughing immoderately, laugh reprimand at, and laughing over the serious matter. So this is what you can think of the people comes to your clinic and smile and laugh a lot without the reason. The question, another things that people who answers wrongly. The start thinking of Baryta when you feel that more than once the patient is answering wrongly. For example, the phone number, the address of the patient, the age of the patient is something everyone, especially grown up, is confidently sure of. But many a time the patient gets confused, gives a wrong address or a phone number, and later correct it by saying, sorry, I made a mistake. The mistakes are allowable, but not in something which defines you, yourself, and your whereabouts. So this is what very important things. Whenever the person is giving the answers wrongly in terms of his overness, his name, or his age, or his address, and his phone number, and everything. So that is what the Baryta personality is. Who people who are confused while answering, the patient comes to you with a backache and that started years back. The patient tells you this backache I remember started when I had been for the mountaineering. I sleep and my wife helped me in time and I was saved. We asked him the next question, what was the age at that time? And the patient asked him back, whose age, mine or my wife? So this is what the confusion in the mind that cannot understand in the context of what we are asking. Obviously, he is confused and he is not in tune with the whole thing that you are asking his history. So this is what whenever you are thinking of confusion, you can think of Baryta. When you need to change your questions 2 or 3 times, so this is what the physician part to understand, make the person understand better and respond correctly, you may think of Baryta because you are dealing with the Baryta people. So this is on the part of physician. When you need to change your questions 2 or 3 times to make the patient understand and respond correctly, you may be dealing with the Baryta. So whenever the person comes to you and in the clinic and you are taking a history, you can be very sure that you are dealing with such a constitution. People who do not understand the importance of the important things or have wrong priorities about the health. So this is again the things you can think of. As the persons grow up, he learns many things and become wise. As a rule, he learns comparative importance of the things. This is the more important than that. But in Baryta, especially Baryta Cup, the learning process is hampered and the importance attached to the various things is improper. Just like a child cannot gauge whether giving exam is more important or playing games. So many examples, so many a times we see a patient coming with a serious ailment, yet stressing and asking for the help for the minor ailment. So this is again the intellect has been gone. So this is the foolishness, this is the heedlessness, and this intellect has compromised. They cannot understand what is most important and what is not. So sir has given many examples. So examples, these are the examples of the real life cases of the sir. So patient gradually emaciating and withering due to the cancer of the liver insisted that he be treated first for his osteoarthritis pain in the knees and get relief so that he can be easily mobile. So this is what very important thing. A brain tumor astrocytoma patient with the recurrence after the operations was consistent in saying that he needs some good soothing ointment for his eczema that had troubled him a lot for many years. He felt that the brain tumor is okay. It can be cut out, but eczema is very troublesome. So this is a very important understanding. Of course, one need to know the right intellectual standard expected from an individual depending on his or her age. A child not understanding the importance of the brain tumor is not a Baryta ailment. An illiterate, uneducated person living in a village or a farm is not expected to know what are the implications and complications of the major disease like the cardiac failure, brain tumor, cancer, etc. Here again, we need not take lack of knowledge as a misplaced word. So be wise in understanding the person that the person who having the right knowledge, and if there is a no knowledge, then you cannot directly put that person into the category of Baryta. Here, the wrong priority even at work or a home are the hallmark of Baryta. So everywhere you have to understand the priority has been wrong. A housemaid who is a Baryta while working in the kitchen will not be bothered about the running tap water that is going down the drain and the drain as the dutifully tries to put the utensils and plates in the place. Nor is she bothered about the gas stove which is burning without the utensils as she is sweeping or wiping the floor. So this is what is wrong priority. Our priority are completing the routine housework in the bargain to hell with the wastage. So whenever you find out this, this is what the symptoms are telling by the relatives or the spouse and husband that he says that सर एक काम में जब लग जाती तो दूसरा काम ऐसे ही चलता रहता है पता नहीं चलता क्या हो रहा है सो दैट इज व्हाट यू हैव टू थिंक ऑफ दिस मेडिसिन इज द राइट टाइम सो दिस इज रॉन्ग प्रायोरिटी एट वर्क people who are fixing the routines, the lack of proper coordinations between the left and the right brain makes the Baryta not adaptable. So this is very important. Fixing their routine. The judgment are totally lacking to change a reaction to the different and changing the situation is totally difficult for them. So they stick to the routines. It is not right to say that they can never accomplish a job. Once they learn to do a job easy or a difficult, and once the process is embedded in their head, they can do things according to it for years without bit of change, without any bit of change. This is not bit. The spelling mistake is there in the book. Without any bits of changes. So this is what the rubric you can think of work desire for mental routinism. There is two remedy Kali Kav and Baryta Kav. So Baryta Kav once they understand how this work has been done. So whenever you find we have find many people are working as a clerk for more than 30 years. Many people they have a time to promote, they have a chance to go higher, but they cannot go because of their routine has been set. So there are people who are working in the textile companies as dyeing masters, and they started their work from the dyeing master, ended their work, they retired with the dyeing master. So this is what something that they have just routine work and they are master in them. So once they understood, they are masters. So work desire for mental routine. This makes the most Baryta routinists the people who have been mechanically doing or doing a boring job routinely for a years without complaining or without trying to do anything different is also could be a Baryta. So whenever you are asking about any occupations and what is that, so the person is saying that I'm a clerk since 35 or 40 years, and the same place I am remaining, and same company I am working, and the same routine work I am doing. If I am given, I am mastering that. But if given another task for that, he cannot accomplish, and you can think of Baryta. An Indian wife having in a rural area where education and literacy is not good enough fulfill her roles as a good wife, housewife. She is trained by her parents and later by her in-laws to be mechanized housewife. Her role transferred from being a dutiful daughter-in-law to a mother-in-law and from a wife to a mother to a grandmother. In all the roles, she has a fixed routine to perform without any change for the years. Any other woman, especially Nux Omega Causticum or even a Pulsivilla, would want a change or a escape from the routines, but Baryta is happy as she is. So this is what you have to understand. Baryta is like a mass transport bus or a train that travels daily and monotonously carrying passengers from one point to another for the years, or a bus playing in its route from day to day, year to year, doing its job as if rooted in. So people who just go on doing a routine job as a clerical job for a years mechanically can be Baryta. So this is what Sir has written here beautifully about this. They never get thoughts in their mind of the changing their jobs or professions that they are very good at. This is because the inability to adapt to any of the changes in the routine. So people who cannot adapt to sudden change for the same above mentioned reason, these are the Baryta peoples. Not only do the Baryta do not change their routine, but also they cannot accept anything new suddenly. They cannot change nor can they accept change in the circumstances. As already mentioned, they are averse to change and the progress. So progress means change. If one cannot improve upon oneself, one cannot progress. Your mind has to be open to experimentations, innovations to foresee the result. To foresee, one needs an analytical mind that can be deduce things and come to the right conclusion. All this is absent in Baryta. So there is no analytical mind is working in Baryta. If at all they come to the conclusion, it will be wrong. To accept anything new is beyond their capacity. Even some surgeons, see, this is very important what Sir has find out, Sir has written in the book that even some surgeons are very much of the routinist. They just cut or extirpate tumors or a tissue according to what techniques are mentioned in the books. They cannot innovate any new surgeries or the techniques. They cannot change their changing times. Homeopaths too, who go on with their routine's way of prescribing and are not open to any suggestion, could fall into this category. So this is very important. Baryta. Homeopath can be Baryta. The surgeon can be Baryta. An intellectual person can be a Baryta. One. Old orthodox people who do not want to change with their changing time, they are Baryta. So this is what very important. Even in some of the community, you can think that the routine has been set from the ancestral pattern, and that also could be like this, and they cannot change. So that could be the thing of Baryta. This obstinacy, despite not getting good result with their old techniques, prevent them from shifting from their fixed routines. However, the scientific could be the argument B. They may refuse the change. For any professional, the question that should be asked is whether they stick to a routine prescribed by the seniors or do they tend to innovate by adding something of their own. If not, one can start thinking of is he a Baryta? So this is what you have to put the question to be asked for this. The question is like the question that should be asked whether they stick to a routine prescribed by their seniors or do they tend to innovate by adding something of their own. So these are the questions to be asked when you're thinking of Baryta. People who cannot use new gadgets. This was the book written in around 2002 or 2004. So this is what Vijayakar sir at the time during the 1996 the mobile came to India, and then the people who cannot understand. But right now, the generation has been understanding the technology but cannot understand the common sense works. Then also you can think of Baryta. So sir has written that people who cannot use gadgets, the modern machines and the equipment. So Baryta, despite being taught again and again, will falter at even operating an ordinary washing machine or a disc player. They do not learn simple things are taught to them, but next time they fail to remember, leading to the frustration and the final conclusion, I cannot operate it at all. I shall never be able to do this or that because it is not my cup of tea. So also in driving a car, a Baryta man or a lady is convinced that he or she will not be able to drive and control such a complicated thing. A pilot of the plane, so sir has also written that a pilot of the plane is supposed to be an expert in maneuvering such a complicated things like a plane. But a patient who was distinctly a Baryta told me that he could fly a plane, but he did not have a license to drive a car because he felt it was the most difficult thing to do and he could not learn driving though he tried it. So the example of this is very important. Even a pilot in the plane, he can draw a plane, but he cannot drive on the road. When asked why, he said that there are more than one thing to concentrate on, and he found multitasking is difficult. So here the rubric is the narrow-minded, he cannot adapt to the situations, and another rubric is work desire for mental routine. Another point in using mobile phones, they are very well versed with the making a call and receiving a call. When it comes to the messaging or any other complicated function, it's as no. The blame is usually put on the gadget which they cannot operate. If there is a hurdle in the path that they tread daily, it is surprising that they cannot avoid stumbling over it over and over again. So this is very important understanding. रोज जाता है फिर भी गिरता है. That is what Baryta is. The people who were born in the 50s or 60s or before do not have a natural tendency to use computers or electric gadgets. The younger generation born in the 80s and the 90s takes to modern cell phones and other electronic gadgets very easily. Despite having a non-electronic genetic heritage, many of the old timers do not have any inhibitions to learn the new technology and its uses. But those who do not want to learn or those who just cannot learn at all, though tutored should be looked upon suspiciously. So people who are incapable or wrongly convinced that they are incapable could be belonging to the Baryta group. The people who cannot do multitasking, this is very important. Persons can be taking only one thing and unidirectional, no multitasking. In this fast moving world, everybody seems to be always short of time. Everyone is rushing to complete his or her work, and that too with the deadline. This requires multitasking, which means trying to accomplish many things simultaneously. This requires multiple concentrations of the focus. A working lady who has to complete her daily chores and then attend to her office generally tries to do many things at a time. She keeps the milk on the stove to boil, and by time it boils, keeps something in oven. And when both these things are getting ready, will set the washing machine to wash her clothes. And when all these are going on, she will sweep the floor and then get ready for office. Thus, so many things can be accomplished if time is used intelligently and tasks are done parallel by overlapping. But this requires intelligence, sharp concentrations, and efficiency. This is just not possible for the classical Baryta, who is not gifted with such efficiency. He or she will complete one work at a time and then start with another work. Even though her attention is not required when something is cooking on the stove or even oven, she will just wait there overseeing, thus wasting time that she could have utilized for other fruitful purpose. So this is what the Baryta people is. They cannot do multitasking. People who do not change their job for the years They do not have the capability to take the responsibility and they refuse promotions for fear of responsibility. Many times in a corporate world also, they are posted as some places and they get promoted many a time, but they do not like these promotions and they remain in the same because when they are promoted, the burden of responsibility has been increasing and they do not want to take it. So this is what the peoples are right now. Even though intelligent people, even they are engineers or they can be high qualified peoples, but do not take responsibility because of fear and they can be a people who cannot change their plans at the last moment. Very important. So the people who plan things in advance can belong to many constitutions. There can be so many reasons for the people to plan their work well in advance. The most important reason is the cautiousness. So people who do not like to make a mistake due to their perfectionist nature is like arsenic who would like to plan. People who are very anxious about the things in advance and have tremendous anticipation that they will plan in advance. And people who do not want to fail at the last moment, lest they may be laughed at. The people who are concerned about their image will plan out so that they always perform the best. The people who know that they cannot adapt to any new development at the last moment will be cautious and plan well in advance too. To the last category belongs to the Baryta. The different categories are that the anticipatories are the Calcarias, the image conscious are the Silicas and performs. So this is what you have to think of. But the last category that people who know that they cannot adapt to any new development at the last moment and will be cautious and plan well in advance too. So this last category belongs to the Baryta. They have their plans well in advance. They cannot imagine making up a trip out to hill stations all of a sudden. They cannot take any decisions at the spur of the moment. So this is what you can think of indecisive personality. If anything does not go according to the plan, everything goes haywire for them and they have no alternative but to withdraw. So this is what the personality is. So people who cannot innovate create properly. So Baryta are the simple Simons. They do not have the ability to innovate or the create. We will not find any artist in Baryta since art require imagination. So whenever you find any artistic personality, you can straight away rule out the Baryta. But Baryta can pose an artist whose work will be stereotype copied and repeated. So keep in mind that you find artist and artist is the same stereotypic work he is doing and copying the same things and repeatedly, then you can think of, but there is no real art and imagination. So this is what you have in the mind. People who cannot observe properly. There is some people who cannot observe what they are supposed to observe. Observations also require the intelligence. What to observe and what not to observe is also governed by your intellect. As Hahnemann says, I do not see what mind does not perceive. If one does not understand properly, one does not see properly. In a brain that is wrong priority, observation will always suffer. Again, you can have a people who can be cheated again and again. So this is what you can think of the Baryta. A Chinese proverb says that if you fool me once, shame on you. If you fool me twice, shame on me. This is the proverb that is apt for the Baryta. If we find a businessman who has been cheated again and again and despite losses does not realize that he is being cheated or relies on the same person who is cheating him, he has to be a Baryta personality. People who do not learn from their mistakes even when correct. So mistake is said to be mistake it is said are the best teacher. This is the corollary to the saying experience is the best teacher. This is not always true of the Baryta as they beg to differ. Experience comes and experience goes, but Baryta never change and never move. They are very difficult learners. They don't learn from their mistake, but repeatedly commit the same mistake. Once an idea is fixed in their mind, it is difficult to change. They obstinately defend their mistake too. A very simple things like an action of opening a door can be made very complicated by the parrot. The patient pushes the cabin door without turning the door knob. When corrected and shown, he will do it at that instant. But the same mistake will be repeatedly by him or her on the next visit and again on the next level. On the contrary, he will argue that the last time he was here, he had to only push it, and the knob on the door is new additions now. So this is what the Baryta argument. So the rubric related to this is learning difficulty. Learning difficulty learns the same thing over and over again, yet remains untrained. This is the Baryta. People who have never changed or tried to change their jobs, even though it may not be lucrative. The people who have never progressed nor they do desire to progress. The people who can never be a leader. So Baryta cannot be a leader. So Baryta constitution can never lead. Always is a follower. If at all it finds itself in a leader's position, it will be go on a beaten track, but it has to be follow either a book or an advisor. The people who have a pseudo ego, though Baryta does not appear in the rubric egotism, seems apparently to have one. It is a foolish, misplaced ego. This ego prevents them from accepting any suggestion from the outside. Whatever they know is right and everyone else is wrong. In argument, a sane person has no chances of winning against the Baryta. Logic does not hold good here. One can argue one's but but a Baryta will be close to all logical argument and keep on harping on one small matter that is irrelevant. If one gets frustrated arguing with someone, one can think of the quarrelsome remedies like Kalika, Boram, Hyoscyamus tertiaria, or the egoistic remedy like Putina, Naxomica, sulfur. And if quarrel is illogical, he should be a Baryta or carries quadrifolia. So whenever you find a Platina-like personality, very egoistic and argumentative and haughty, but does not understand by logic, and they are very illogical, you can think of it as the Baryta. So it is like Platina, but having no logic behind that. So in short, the Baryta, what we think is right, and think is right, and what other think is all wrong. So this is what Baryta always feel like this. But here, one positive sign of the Baryta is intellect is Baryta has an excellent ability to do a fixed job. Once they are used to a particular job, no one can beat them at it. However, howsoever complicated the job, once they have routine mastered it, they can go on doing it for years without mistake. Such Baryta makes excellent clerk, accountant, workers, teachers, doctors, etc. Fix ideas and routine rule them. They never break rules, not only because they have no ability to circumvent the laid down rules, but also from the fear that they might not be able to tackle the after effect. The patient father best described his daughter. Her brain works like a computer. Whatever has been fed will come out as it was fed without any mistake. There is not even a 1% chances of the mistake. But if you change the track or ask something that has not been taught to her, she get puzzled and her brain will not give any answer. So this is what you have to understand. The positive side of Baryta is they learn properly, but when you change the track, they cannot understand it. So we conclude the day today here, and we will continue from tomorrow. We are understanding the one word is a misplace, and we are understanding misplace in a variety of the situations, and everything in Baryta is misplaced. So we will continue the session from tomorrow morning. Hope you can have a little idea about the genetics of Baryta so that we can have people comes to our clinic and we find that this could be the Baryta. So thank you so much. We conclude the day today. Wish you all. Thank you so much.